All right, so good afternoon, everyone,
Good afternoon.
and welcome. Glad that you could join us today. And today I'm very happy to be able to host Ms. Kandel Bostwick from Global Compliance Service. And I know that Kandel is going to be taking us through today the ISO 45001 standard, and we will all be able to learn more about exactly how this, what this standard is all about and how it could serve our organizations. Kandel, good afternoon, welcome.
Good afternoon, Dr. Dorga, and thank you for having me. It's indeed a pleasure to be here this afternoon to share with our viewers the benefits of the ISO 45001 standard. And basically, yes.
I know joining you as well, we have Daniel Sukrim. If Daniel can give a wave. Daniel is in charge of business development, and he's a point person for really that first interaction and making sure that people get to understand exactly how they can get on board. So yes, Kandel, you were saying?
Yes, I was saying that today we're going to be sharing with you how implementing an occupational health and safety system can improve productivity.
Right, and as the host today, just a little bit about your host today. I am very, very passionate about standardization and making sure that organizations in our country are really operating at the best possible level and that they have a system that allows them to deliver at the best possible level. I myself was also, one of the former chairs of the National Bureau of Standards, the National Standards Council. And I know how important it is and the benefits that it brings to organizations of really figuring out which standard governs their operations and then, first of all, becoming compliant. And if your industry warrants it, becoming certified as well. And I'm sure that Kandel is going to really take you through those benefits. And then I'll hand you over now to Kandel, and I'll join you again during the Q&A.
Okay. Thank you, Dr. Durga. Well, I am Kandel Bostwick, and as mentioned before, I'm here to share with us today the requirements of the ISO 45001 standard. My background stems from over 18 years working at the National Standards Body in Guyana. So I would have been exposed to conducting audits, training on a wide range of management system standards. And I was also able to visit a number of companies locally and overseas to see how they would have applied these different management systems to their respective organization. And at this point, we think it's very important that we are aware of the benefits of the ISO 45001 standard, which was published in 2018 by the International Organization for Standardization. So for this webinar today, I'll provide with you a background about occupational health and safety requirements, why it's important for us as businesses, especially those businesses where our activities are classified as being high risk activities. That is, they can cause injury to our staff. The benefits of implementing the system. I'll provide a brief overview of the ISO 45001 2018 standard, and I'll give you the list of some of the areas that you can address to know that you are compliant with the standard. Then we'll have some concluding remarks. So, looking at the illustration before us, we see what is happening before and after ISO 45001. So according to ISO, you can see in that picture, there is much chaos in the work environment. The activities are not streamlined. You're prone to accidents, mishaps, injury, and look at how everything has been organized since ISO 45001 has been published. And I know some of us may have an environment where indeed the safety of our workers can be considered as being challenged. So I can assure you that once you implement the ISO 45001 standard, you can see a reduction in workplace accidents and also illnesses. So some questions for us to think about when it comes to safety. Why is safety important? And every day we leave our homes and we go out into an environment. I'm sure all of us have the expectation that we return home safely. But unfortunately, many persons do not return home safely. Sometimes they return home being injured with a broken limb, they would have lost a limb, right? So sometimes our environment is not always safe. And then how do we know when we are safe? And do you actually believe that you are safe? So as we go through the presentation today, think about these questions to see if you're really safe within your work environment. And it's important for us to look at the statistics that are available to us through ISO. And in one of their publications, it is indicated that the International Labour Organization has said there are over 2.78 million deaths as a result of occupational accidents or work-related diseases. And that is a very, very large figure. And Guyana is of no exception. We will have our share of occupational accidents. Also, we have the Institute of Occupational Safety and Health. They've estimated 660 deaths a year as a result of cancers resulting from work-related activities. And when we look at some of our sectors in Guyana, like the agriculture sector, the mining sector, right? Also in our forestry sector, we will see that there are a number of accidents and the impact that those accidents would have had on the business, on the operations, on the workers, on their families, and on their communities. And the records from the National Insurance Scheme has also communicated that 75% of those accidents, for example, persons have to claim for benefits for medical and treatment. Most of it is from the sugar industry. And also, most of it involve men. So the ISO 45001 standard, which is the Occupational Health and Safety Management System standard, which provides requirements for guidance and use, basically provides the requirements to ensure that our workers are safe. So the emphasis of this standard is on the safety of our workers. When we look, those of you familiar with the ISO 9001 standard, you will agree with me that the focus of that standard is to ensure that our customers are satisfied, that we deliver quality products and service. On the other hand, the ISO 45001 standard focuses on workplace, the safety of workers in the work environment. And once you implement the system, you can be assured that there will be a reduction in workplace accidents. So you'll implement a system that will make your environment safer, reduce absenteeism and staff turnover, leading to increased productivity. We know that when our staff are involved in an accident, at that point, the entire operation stops because you have to provide assistance, you have to get medical care, so you have a reduction in your activities, which can slow down production. And then, based on the severity of that injury, that staff may have to have medical treatment, they may be hospitalized, right? They may lose a limb if it's with machinery. They can have burns to the body, depending on the environment that they can work with. So it affects the entire operation for that organization. Reduce costs in insurance premium. You know, when an organization has a lot of claims, when you're part of a medical scheme, a group medical scheme for your organization, and there are a number of claims, and the claims exceed, let's say, 75% of what you pay, the insurance company normally comes and say, okay, we have to increase your premiums because you're going beyond the 75% mark that we would have catered for you. So that affects the workers as well as the employer because everyone has to pay more. So with the system with reduced accidents, you have reduced costs on insurance premium. Also, it allows you to create that health and safety culture. I'm sure many of you would have visited organizations that you see at the door. Safety begins here. So, you know, once you step in, the culture of that organization is to embrace safety. It also focuses a lot on leadership's commitment. The top management of the organization is held accountable for the performance of the occupational health and safety management system that's implemented. They have to ensure that all the resources are available so that the environment is safe and also the workers are safe. The organization has the ability to meet legal and regulatory requirements. For example, in Guyana, we have our Occupational Safety and Health Act, and persons will now be acquainted with that act, and based on the category that they fall into, they will know what requirements to meet. And of course, you'll have enhanced reputation. A company with zero level accidents or a companies whose accidents have moved from 20 per month to 5 per month and then eventually zero. So it improves staff morale when they see that they're operating safely. They've been provided with the necessary personal protective equipment to do their activities. Management has put appropriate controls in place to ensure that hazards do not affect them. So, some of the success factors of this safety and health management system, as I mentioned before, a lot of the success is born on the performance of top management and the commitment that top management has towards ensuring that the occupational health and safety system is implemented. They are the ones who are expected to create that culture of safety within the organization. Once they set the occupational safety and health policy and they set objectives, they're to provide the necessary resources to support that policy. I'm sure some of us can attest to the fact that there are some companies where there are lovely policies about occupational health and safety or about quality. But then when you look at the implementation or commitment towards it, it's quite the opposite. So top management has to play a leading role in ensuring that that safety system is effective. So if you're a member of top management, we have to zero in on the areas that will cause sickness to our staff, the unsafe activities that we're doing, and ensure that measures are put in place for those activities to function in a safe way. So the policies also that are established must be aligned with the strategic objectives and direction of the organization. And since the standard focuses a lot on workers, there is room for consultation. So top management has to consult with the workers to hear their views regarding the safety of the jobs that they're doing, regarding if they have any grievances about the work environment. Top management has to provide evidence that they would have consulted with the staff and they've provided mechanisms for them to participate in the decision making of the organization regarding the safety of the equipment, use of the safety equipment, the PPEs, and the controls that are put in place. So it's very important that top management has an integral role in, for example, identifying the hazards, which we'll look at a little later in the presentation. And once those hazards are identified, to put the controls in place that will reduce or eliminate those hazards wherever it's possible. And also there are opportunities where they can improve the way in which work activities are done. And as with all management system standards, one of the focuses for continual improvement. So the organization will continue to improve, show evidence of improving the way it operates. For example, they would apply what we call the denim cycle, where you plan, and we look at the section, the standard, which focus on planning. You do where you implement, and then you do a check. You evaluate the performance of the system and you act. So there is that continual improvement, improving the safety of the work environment, and you should see evidence of safety protocols being implemented and being addressed. And the ISO 45001 standard is very unique, where it can be easily integrated into other management system standards, like the ISO 9001 standard. The requirements are quite similar, but the focus here is on the safety of the workers. This standard targets all types of organization, irrespective of the size. But what is important, it is very relevant to organizations that are engaged in activities that can expose their staff to injury or occupational safety and health illnesses. So if you have activities within your organization where staff have exposure to different hazards that can pose a risk to them becoming ill, right? This standard is very important to you. Now, the purpose of an occupational health and safety management system is one, to provide a framework for managing your occupational health and safety risk, right? How you manage the risk involved in your operations. And the risk basically tells us those things that can cause injury. Also, it prevents work-related injury and ill health to workers. So if there is any activity that you're doing that can cause injury to your staff or cause them to become sick, we can see that as a risk that has to be addressed. And also, it helps to provide safe and healthy workplaces. I'm sure all of us would like to be in such a work environment. So as I mentioned earlier, if we look at the denim cycle using the plan, do, check, act version, in the planning phase, which we will look at shortly, you have to consider the external and internal issues of the organization. The context of the organization has to be addressed. You have to look at the needs and expectations of interested parties, and that will also include your staff, right? And also, you have to look at the scope of your occupational health and safety system. So when you're applying the ISO 9001 standards, not for the entire organization, but it focuses on those areas where there are activities that can cause injury or ill health to your staff. After you plan, you're now provided with support where you ensure that you have a competent staff, there is awareness and so forth for staff so that the system can be effective. So support and operations, those with the doing phase, the things that you have to do, the things that top management has to play a leading role in. After you have implemented, you have to check, which is in clause 9, performance evaluation. And then you move towards improvement. So after you check, you've identified, you see how you can improve, and so the continual improvement of your occupational system is realized. Now, these are the requirements for the ISO 45001 standard. There are 10 clauses, but from clause 4 to 10, those clauses stipulate the requirements for implementing the management system standard. And those of you familiar with the ISO 9001 standard, you can see there is a easy cross-reference between the two standards and other management system standards as well. So with your scope, you need to define the scope of your system. But the scope of this standard, right, is that it specifies the requirements for occupational health and safety management system. So those of you who would like to implement such a system, this is a standard. It specifies the requirements and it gives guidance for use. Because at the end of the day, we want to ensure that you have safe and healthy workplaces, and also you prevent work-related injury and ill health. So that is the whole purpose of this standard. So there's some special terms and definitions within this standard, which I'll basically quickly go through. So when we look at the standard and we see the terminologies, we must be able to apply it to the standard. So for example, a worker is anybody who's performing work duties on site, or whether they have to go off site, right, to do work for you once you're under your charge. Consultation. The standard speaks a lot about consultation. That is consulting with your staff. Top management has to consult with your staff, and we see what that means. Not top management works independently of their staff, but they must meet with their staff, hear of their views. For example, if you have the occupational health and safety committees, the reports from those committees should be considered by top management and they provide feedback, right? Of course, the workplace is anywhere where that staff does work, whether on site or off site. We have to ensure that that is safe. And the management system we're going to implement is one that prevents injury and ill health, right? So our work environment, when we're implementing this OHS system, we must be assured that it's going to prevent injury and ill health and also provide a safe and healthy workplace for our staff. And when we see the terminology of injury and ill health, so if you have activities that cause injury, and you have the definition there, it's any physical, mental, or cognitive condition of a person. Once you affect the health of the person, that means that activity needs to be zeroing on for the system. A hazard is defined as a source with a potential cause for injury and ill health. So reflect on where you're working and see if there are any activities that you do that has pose a potential cause for injury and ill health to your staff. Are there areas or activities which are prone to accidents within your workplace? Those are some areas you can pay keen attention to while developing such a system. And the risk is the effect of uncertainty. You do not know if it will happen or not. The probability exists, it can happen. It could be based on industry statistics, it can be based on your infrastructure. So basically, occupational health and safety risk is basically a combination of the likelihood of someone actually getting injured, right? Based on the number of times they may be exposed to a particular condition. So I'm going right into the standard now. Now, clause 4 deals with the context of the organization. And we must be able to understand, in 4.1, it tells us that we need to understand the organization and its context. That is the type of environment in which we are operating in. For example, you will agree with me that over the past 2 years or so, there has been a buzz about implementing an occupational health and safety system, the importance of safety because of the oil and gas sector. And that is very important. So our environment now will cause a number of businesses, a number of high-risk businesses to implement such a system. So in terms of the context, we can do a little SWOT analysis of our organization to look at our strengths, weaknesses, opportunities, and threats when it comes to safety of our workplace, safety of our staff, whether we are meeting our legal requirements. So what are our strengths? Are we aware of the legal requirements governing our operations? Are we following the requirements in the Occupational Safety and Health Act? Are we providing adequate equipment to staff? Do we have adequate controls to prevent occupational injury or diseases to our staff? We can look at the values. Do we have a safety culture? When we provide the PPEs to our staff, is it the culture that staff wear their safety equipment or they just set it aside? What is the culture and what needs to be changed so that we can become um, effective in ensuring that our workplace is safe as well as our staff? We must understand the needs and expectations of our workers and other interested parties. So you can think about what are some of the needs of our workers and expectations. So, for example, our workers may need a safe environment to work with. Nobody wants to be in an unsafe environment. They want to maintain good health. They don't want to come on the work site and get a disease because of being exposed to chemicals or fumes or dust. They want to be protected while they're on the job. They want to have the appropriate safety equipment to use. They want their voices to be heard, and we want to have consultation with management. And they may also expect you to provide a safe work environment to them. They expect to be compensated if an accident occurs. And they expect top management to address their needs if they have anything regarding safety. Then we have to determine the scope of the safety management system. And how we define the scope, we basically have to do an assessment of our organization and identify those areas or those activities that we are engaged in that will cause our staff to become ill, injured, sick, things that we do that can cause accidents. And then when we do that, we do what we call a risk assessment to find out the severity of those risks, right? So as mentioned before, these are just some examples of our interested parties, the internal parties as well as the external parties. And I'm sure most of us can agree with those stakeholders we see identified there because they all have a role to play. But in this case, we're focusing in terms of occupational safety and health. For example, for the external parties, if you're doing construction in a community, the community will have interest that, okay, whatever you're doing, okay, we know sometimes there's a dust pollution, you can have noise, right? You may have fumes. So that community will have an interest that, okay, when you come, it will not affect our health in whatever you're doing. The regulators want to ensure you meet their regulatory requirements and so forth. So we have to pay keen attention to our internal and external parts because that will shape our management system. Leadership, as I mentioned before, leadership has a very important role in ensuring that this occupational safety and health system is effective. There must be leadership and commitment, which is demonstrated by top management. They're responsible for communicating the health and safety requirements for the organization. They set the occupational health and safety policy, they set the objectives, and they put systems in place to ensure that those are met. The roles and responsibilities of staff within the organization will be clearly defined. They ensure that staff are competent to perform the different work-related activities, especially those high-risk activities. They have to ensure that the staff are adequately trained and also observed to ensure that they are competent to execute those activities in a safe manner. Also, there should be consultation with the staff, right, on communicating the requirements of the occupational safety and health system. So top management has a very key role in communicating and also ensuring that the system is adequately maintained and it's effective in consultation with staff. Now, planning is very, very important in anything that we do. And like how we would have planned when we developed the other management systems, Likewise, we have to plan when we're developing a safety management system. So we have to look at the actions that will be done to address risk and opportunities, because in identifying the risk, there can also be opportunities for us to change the type of equipment we're using, to use more technologically advanced equipment, to change a particular process, to make it a safer process for our staff, or to even stop doing a process if it's very unsafe and we may outsource it to some other agency that has the capability. So we have to take into context the areas that we would have identified in clause 4. That is the context of the organization, the needs and expectations of our interested parties, needs and expectations of our workers in particular, and the scope of the occupational safety and health system. So in developing this plan to implement the system, we have to consider those factors that we would have identified in clause 4. And also we need to identify the legal requirements that we have to follow, or if there are any other requirements for us to follow to ensure that we are compliant. So we plan and then we will implement that system. So it's very important that we plan for the implementation of the occupational system. We have to set objectives and plan to achieve those objectives. For example, I would have mentioned if you want to reduce workplace accidents, right? You want to reduce injury. Those are objectives that you can set. And likewise with the other management system standards, we set objectives that are measurable. They must be smart. They must be specific. We want to reduce the number of accidents in the warehouse by 10% come December 2020. Or we want to reduce them from 10 per month to 2 per month. And all of this takes into consideration our infrastructure and the resources that we have available to us. So the plan that we present is to reduce the undesirable effects within our work environment and to achieve continual improvement. So when determining the risk, when we look at the hazards, what can cause injury on the work site? I know how can we address it. We look at the occupational safety and health risk, right? And we look at our legal requirements. So these are some of the areas we will consider while planning for our occupational safety and health management system. So I am hoping that you are contemplating in your mind activities in your workplace that would have caused accidents or illness to staff, or they're prone to accidents. Sometimes it has not happened already, but they're prone and you don't have any systems in place. So when we look at hazards, there are basically 5 main classes. So within our work environment, the hazards will be different depending on the type of work we're doing. So physical hazards, electricity. This may be a hazard, for example, if you're an electrician, let's say, you may be exposed to electric shocks. What will you put in place to reduce the electric shocks or eliminate you getting those electric shocks? You have radiation, you have extreme hot and cold. There's some manufacturing entities, for example, the storage facilities. There are some items that have to be stored at very high temperatures. What measures do you have in place to protect your staff when they go into those storage facilities, those cold storage areas? You have chemical hazards. Persons working in laboratories, for example, they may be exposed to many chemicals, to fumes, acids, spill. You can have burns if you inhale fumes. Some of them are very dangerous. What measures do you have in place? So within your environment, you look at what can cause ill health and injury. So it could be physical, it could be chemical, if it's biological, the hospital setting, in a medical laboratory setting, you have exposure to body fluids, which are classified as being infected, right? Disease can be transmitted from those hazards. So you put systems in place to prevent your staff from being infected. That's why you see the staff, they would wear their gloves, they have on a mask, they use a fume hood, and so forth. Then you have the ergonomic hazards, the design of work tasks, right? Are we doing our work in the most effective way? That is why some persons do what we call a floor plan or a process flow, in and out. So you have a good process flow, the design of your workstations. We look at the ergonomics, right? Your sitting position, your posture, right? Body force, if there's lifting and moving of objects, how that is done, how safe it's being done. Then we have the psychosocial hazards, which could deal with stress. Is the environment high stress? Is there a need for high concentration? How well do you support the staff? For example, staff working for long hours, let's say a forklift operator or a heavy duty truck driver. When we look, for example, at our pilots, they have designated flying times after which they have to rest, right? Likewise for construction workers. So we have to really evaluate what hazards exist within our environment so that the environment can be safe. And what we will do after we identify the hazards, we do what we call a little risk assessment. And this table basically shows one way in which it can be done. So we have the probability of failure, right, versus the severity of it. So, and then we rate it. So if you look at it, it tells us those in the dark red is very high risk. It can be catastrophe, right? It can have a major health impact. For example, they said major effect. It could have a national impact. They have industry impact, local impact. So we can evaluate the activities that we're having. So for example, if you're engaged in welding, as an example, what is the probability of you being exposed to the light, the fumes that can cause injury to you? And what measures you have in place to mitigate the risk? So then you can see how high that risk is. So if you have the right protective equipment, you're following the established protocols, you are trained, and you are competent to handle the equipment, in that case, the probability of you having that accident will be very low. It may be minor or it may be negligible, versus someone who is doing welding and they're not using the appropriate protective equipment. Likewise, for construction workers. So remember, you're assessing your current situation. You're constructing a high-rise building, and you have to go at high heights. You have the straps, and you have the different safety equipment in place to prevent you from falling. Your risk of injury will be much lower than the construction worker who climbs to the fourth floor with no helmet, no support, and they're working from that floor. I'm sure when we drive around Guyana, we will see some sites where persons are equipped with the necessary safety equipment, and there are some areas where they're not. So we have to look at our context in which we operate in. There's some environments where we may have the laborers, we have a warehouse, we have heavy boxes or crates coming into the warehouse. We may have the laborers lifting those boxes from one point to the other, right? They're not strapped. They're lifting without any guards or so forth. right? They're at the risk of back injury. They can fall, they can slip, the item could fall on their foot. They're given no safety equipment. So there, the severity of their injury could be much higher than an environment where the staff is equipped with the safety shoes, they have the helmet, they have the strap. And in some cases, you even bring in a forklift to assist with moving the heavy items, right? And I know introducing a forklift will bring out a risk, but we have to ensure that the forklift driver drives at a particular pace. The environment is adequately labeled so you won't have persons in the way of the forklift, and then how you stack the items up on the shelf. So it's a type of practices that we have that we may have to change. So some organizations will find that when they do the assessment, they're at a higher risk than others. And if you're at a higher risk, it now gives you the opportunity to address those risks. So those risks can be addressed in this way. The most effective way is to physically remove it. Don't be engaged in that type of activity. But of course, there may be some instances where it has to be done, even though it's high risk. And there's where you provide your necessary controls, you have the personal protective equipment in place. There are some cases where you can substitute. For example, the laborer, you may use the forklift instead, right? You have engineering controls you can put in place, like your fume hood, right? Your oxygen mask, and so forth, right? So engineering controls can be placed. For example, the microbe lab, you separate that laboratory how it's operating when compared to, so the air doesn't mix with the other laboratories. Administrative controls are also put in place, the way the work flows, right? So you look at your workflow to see how that can be improved. And the one that is least effective is the use of your personal protective equipment. So planning for this occupational safety health system is very critical and it's really the brain of your safety system. Because once you identify your hazards and you know what is required to reduce it, you then implement. Now, after you've done that, you need to have adequate resources, and that is where clause 7 comes into play. We have to ensure that we have the resources, that is the personal protective equipment. We have to ensure staff are trained and they're competent, the facilities are available so that staff can work safely. We have training, there is awareness, occupational safety and health awareness for staff, so everybody is aware. And then you have that period where you can change the culture of the organization from one that is not too keen on safety to one that is more keen to safety and adhering to safety protocols and safety culture. For example, you would have seen, for example, if person stops smoking, you show them what are the effects of smoking. So it will dissuade people from doing what is not correct. We have a number of videos that persons can reference to convince person that we need to work safely. Communication. Top management, for example, has to identify responsible communicating on the objectives and the policies of the safety system. Ensure staff are aware of it, what is expected of them. If they do not follow the protocols, what actions will be taken. Also, how you communicate with your external parties, if it's your contractors, visitors to the operation, persons who you outsource services to, you must have a system of communicating. And I'm sure by now, many of you would have been exposed to a safety briefing. When you go to some facilities to do training or to do an activity, there is always a safety briefing so that you can understand the requirements of that occupational safety and health system, what is expected of you while you're on site. So that is very important. Communication is very important to ensure that this system is effective. The staff are aware, for example, of the hazards, the controls that are in place, why they're in place, so that the system can work effectively. Even while you're purchasing items, you ensure that when you're purchasing your equipment or any item for the company to use, especially in these high-risk areas, you consider the safety of the equipment that you're purchasing. right? So we must ensure, the organization basically goes through a transformation of risk-based thinking and the culture of safety. So anything that you bring into the organization, you have to ensure that it is safe. It will not create an additional hazard into the environment, right? Documented information, like any quality system, this system also requires you to provide certain documentation that the system is functioning effectively. And those documents must be controlled and be made available. In a safety system, many times we'll have a lot of posters up with guidelines, work instructions so that staff can follow the protocols, and they're constant reminders. So you have your policy and your scope, for example, that needs to be documented and communicated to your external parties. People must know that your company is committed to safety and ensuring that the environment is safe. Now, when we go to clause 8, that is where we really implement all those systems that we would have identified during the planning phase to ensure that they're working. And the whole objective is to eliminate risk. So when we set our objectives, we're able to see how well we would have implemented the system and how safe our environment has become. So for example, if we used to have a lot of persons slipping on the wet floor, and you have an inspection, you can now see, okay, when the floor is being mopped, there is a sign up telling persons the floor is wet and proceed with caution. So if we've seen that we've moved from 10 persons falling when the floor is wet to 5 or to 0, it shows that our method was effective. The use of the PPEs by staff and the reduction in accidents, that is what we'll see as we implement those high-risk areas in our operations that we would have said would cause ill health and injury. So we have to be able to manage the system while it's in place. So somebody will be monitoring it. You're doing your walkthrough inspections. I know the occupational safety and health officers would normally do the daily inspections to check to see that everything is going according to plan. Also, you must have systems to manage and change. If you have a change in staff, change in your equipment, you must have a system of how you introduce that change to ensure that there is not a risk. So for example, if a new staff comes on board, you won't just put them to use the equipment that you know can cause them injury. You ensure that they're safe, they have the protective equipment, and they know how to operate equipment before they start to use it. Right? So likewise, when we're doing our procurement, we ensure that we only buy safe equipment that have safety guards, shut off buttons if the equipment is malfunctioning. When we outsourcing our services, so we have to ensure that those contractors are adhering to the safety protocols. Right? Likewise, we would have been seeing that evident with the oil and gas sector. For you to do work for the suppliers, you have to show at least you have a policy in place. So it's the same thing with them. They want to ensure that when you go to work for them to provide a product or service, you're doing it in a safe way. This is very important. We also need to have an emergency preparedness and response plan. What do you do when an accident happens? We must never be unprepared, right? So you're able to take action very quickly and rapidly for any accident that takes place in your environment. And many of us would have that. For example, those of us who have the fire safety drill, if you work in an environment where you have a lot of flammable materials, you have your fire safety system in place. We normally see some person even do a simulation exercises. A fire take place. If there is an injury on the job, what do you do? Healthcare professionals that are alerted if there is an accident and their response time. So you must be able to check that plan that you have in place to ensure that is effective and it is working. Now, after you would have implemented all of that, you have to monitor and measure to see how well you would have implemented your occupational safety and health system. Basically looking at, okay, did you meet your objectives in terms of accidents, in terms of ensuring that all your staff are trained and are competent, they are aware of the safety protocols? So we have to do an assessment of our occupational health safety system. We have to evaluate compliance with our legal requirements. For example, if you would have had fines in the past for not adhering to legal requirements, did we have any fines since we've implemented the system? And if there are no fines, of course, the company gains because you don't have to pay out money for fines. Instead, you can use it to improve your system, right? And also reduces the risk of you being fined. So you have a system where you monitor the legal requirements, any new changes, you're aware of it, and you can address it. Even conduct internal audits of your occupational safety and health system, like is very common with our internal audits of any management system, to ensure that the policy and the objectives have been met. So we have an audit basis is an independent process to see if the requirements that we set out for our occupational safety and health system, if they have been implemented, how well they have been implemented. If we identify any non-conformities, if the corrective actions were effective. Then of course, top management makes a review of that quality system to look at the effectiveness of the safety system. How well was it implemented? Were the hazards adequately controlled? Did we have a reduction in accidents and injury to staff? Did we see a reduction in our insurance premiums? Right? Are staff more willing to come forward with um, areas, hazards that they would have identified? Right? Are we consulting with the staff as we ought to? So at top management level, they basically review the system, the safety system, to see how well it was implemented and the effectiveness of that safety system. 10. So after we would have reviewed the effectiveness of the safety system, we go to the continual improvement aspect, where, for example, if incidents have occurred, actions were taken, were they effective, as well as non-conformity. Similarly to how we address it in our order management system standards. And those corrective actions, have they been implemented, and how has the system improved? So the continual improvement process tells us that we can, in a very incremental way, improve our occupational safety and health management system, improve our performance in terms of reducing accidents or incidents within our work environment. Now, some of us may want to know, what is it we need to do to ensure that we are compliant? And some of the things that the standard identifies include, we must have that policy and objective. So that is the first step. We must have a commitment towards safety, ensuring safety of our employees and our work environment, and that we're going to do our activities safely. Then we define the scope of that safety system. And our scope basically focus on those high-risk areas within our activities. And it's those areas that can cause ill health and injury to our staff and others. Then we need to show that we've done an assessment of the risk. So we need to show that we've actually assessed the risks that we've identified, and we've categorized them as high risk, whether they're low risk, and we've identified those that we will address. The legal requirements, we must be aware of the legal requirements that we're following that govern the type of activities we are doing at our organization. The emergency preparedness plan, what will we do if an accident happens or if an incident happens, right? So we need to have that plan in place and show that we've actually implemented that plan. Results of evaluation, how well is the system performing? So we must have these documents in place that we would have done audits, the results of our management review, and to show that we're committed to improving safety within our work environment. Right, and we're really managing what is happening in terms of worker safety. So in concluding, I'd like to encourage those of us, because I'm sure you would have been reflecting on, if there are any areas within our work environment that is not too safe, and we need to take action. So, implementing the system, we will see a reduction in workplace accidents and illnesses. We'll see improved productivity because we won't have so many stop times to deal with emergencies and accidents. Increase health and safety culture within our organization. Our motto will be safety comes first. So a staff will not be penalized for stopping an activity that is unsafe to him or her. Top management will recognize the importance of safety over productivity. We'll have a healthy workforce working in a safe environment. And I'm sure all of us will be happy to know that we're working in such an environment. So I thank you for listening, and I hope that this information will be very valuable to you. And I encourage you to do an evaluation of your operations to see the degree of hazards that can affect the safety of your workers. So together we can implement an effective occupational health and safety management system.
Thank
Thank
you.
you. Yes, yeah.
Thank you very much, Kanel, for sharing that very valuable information. And I'll also ask Daniel if he can also come on screen so we can address some of the questions that came up, because some of them are more about engagement. And just to get us started, and to the persons joining us live via Zoom as well, if you have any questions you would like Kandel to discuss, please drop them into the Zoom chat so that we can also address those. And just see here. Great. So one of the first questions we have here from Austin is, what training qualifies someone to become a safety professional?
You have to, when you say safety professional, it can be two angles. Safety professional in terms of being an auditor, right? So you can become an auditor, you could become a trainer or a consultant. So there are many areas where you can focus on. So if you want to become a trainer, well, one of the things is that you should be trained on the standard and be familiar with the requirements of the standard and the application of that standard. So at Global Compliance Service, we would provide training. We provide an introductory training on the ISO 45001 standard to give you a foundation about safety. Then we have a training on the requirements of the standard. We're able to interpret the requirements of the standard. Then we have training to be an internal auditor. I mentioned in the presentation that if you're an internal auditor, you can then audit the safety system, and then you can become a lead auditor if you'd like to audit for organizations or on behalf of organizations. So as a professional, you will need to at least have those training. There are no special prerequisites, but once you have your industry experience, I can add to your training experience so that you'll be able to help others to implement that safety system.
Just checking in with the persons on the Zoom call to make sure that they can also send questions in the Zoom call. Let me just check here. All right, so pretty broad question. How much is the investment for ISO?
In terms
maybe the
of
person meant maybe for their organization or so, but how does GCS go about in terms of determining the cost for certification? So maybe Danielle can take that one, and then Kandel, you can add anything else. So
sure.
Danielle, how do people go about this?
That's an excellent question. The first part of becoming certified is to get a quotation. You can reach out to our office and we will send to you via email an application form. The application form is as basic details of the organization. And when you submit that, you list the scope, which is the area you wish to have certified, if it's manufacturing or a part of the organization, the number of employees, the number of locations, very basic details of the organization. Based on what you've submitted, we will take the details and compile a quotation and send it to you, which the quotation is specific to your organization. So there's not a flat rate, one price for everyone. Each organization, depending on the criteria you've selected, the quotation is tailored to suit exactly what you're looking for.
Kanal, anything you'd like to add to that?
Well, I'd just like to add that persons who are interested in implementing the safety management system, you must note that it does not cover your entire organization. The focus of this system would be basically on your high risk areas. Those processes that you are doing that can cause ill health or injury to your staff, that may affect persons in the environment. So basically, the system that you will implement is to provide assurance that while you're doing your work, you're doing it safely and in a safe environment. So just for persons to know that. So be very specific with your scope. It's for the welding operations, it's for fabrication, it's for construction of high-rise buildings, it's for let's say in the sugar industry, looking at cutting of cane or grinding of cane. So whatever is that activity where your workers are at highest risk, that should be your scope. So you really need to assess your system before you actually apply or define your scope for ISO 45001 certification.
I think you also mentioned mining and oil and gas,
Yeah.
and really, those type of activities where people are exposed to significant risk. There's also a question that just came in from Olivia. What is the name of the organization that offers the training that you mentioned in terms of becoming a safety professional, or as you mentioned, auditor or lead auditor? Where could that get done?
Global Compliance Service, the Unlimited, we could have it done. And also we have a program where we would also certify professionals based on completion of the criteria that you're required to have. So you can also contact us, as Daniel mentioned, to have those training programs. Or you look out for when we schedule the training programs and you participate in them.
Maybe I'm thinking if you can advance that slide one more so that the contact information is going to be up there, right? So that persons will be able to make contact and get that type of information as well. Another question that came in is, how fast can I receive my ISO certification?
You can receive your certification once you have your system implemented and we schedule the audits. Within 1 month, the process can be completed.
Which
And that
part
is,
of, yeah, go ahead.
and that is bearing on your the company's level of readiness or the level of effectiveness of where the system is implemented when the audit is completed.
You did mention as well that GCS is based in Guyana, which does that mean that the auditors are also based in Guyana?
Yes, our auditors are located or resident in Guyana to conduct the audits. So that's an advantage to businesses in Guyana because we basically will save you the cost for airfare and accommodations for auditors coming from other countries.
Then generally auditors from other countries, what I've understood is they come from the US or they come from Europe, and
Yes.
the cost could be significant for both their flights, accommodation, meals, and all of that. So that's a significant savings. Maybe this one is one for Danielle. In terms of the cost, are there any major hidden costs?
That's an excellent question. For the persons on the call that would have shopped around, if you got your quotations from other companies overseas, you would notice a lot of terms and conditions. There are a lot of hidden fees that can be associated. One of the major ones Vishnu mentioned, it is the cost of the airfare, accommodations, and the related expenses. With GCS, when you have your quotation, That's it. That is your quotation will cover your application fees, your certification, your surveillance audits, and you will be certified for 3 years. So that is the entirety of it. There's no airfare and accommodations. All of the team is already in of the country. We can drive to your location, complete your audit, and have your certification delivered directly to your office. No additional fees.
All right. Is there any obligation for requesting a quotation?
No, there is not. Similarly, if you're shopping around for a vehicle and you ask for quotations, the company is obligated to give you a document stating the total price. The application you receive, that we send to you, when you send back your details, we use that to prepare a quotation. We will send that to you and you can use it for your planning and your budgeting. Depending on the size of your organization, you might be able to do it in first quarter, second, third, fourth, and such. That way you have something to benchmark and to include in your planning to become ISO certified. It's a quotation similar to a quotation for anything else that you would purchase. There is no obligation to it. You will be able to see all of the costs associated with your certification and be able to make an educated decision to become ISO certified.
Great. All right. I think we basically exhausted the questions. Are there you would have done a presentation, I think last month was ISO 9001, which is all about quality management systems. Today we have had 45001. What are some of the other standards that GCS certifies against?
We certify against the ISO 14001 standard, which is for the environmental management system. The ISO 22000 standard, which is a food safety management system. And we have other standards for the tourism sector and also for the oil and gas industry. There is a new standard out for the oil and gas sector.
Great. Right, I think that was the last one that came in. I know that we're about 7 minutes over. Kandel and Daniel, thank you very much for investing the time here today and educating the public even more on what standardization is all about and what the benefits are all about. In closing, Daniel, anything else you would like to add?
All of the companies on the call, thank you for your time. Feel free to reach out to us and we'll assist you as best as we could in terms of guiding you towards the ISO certification process, assist you with quotations and any other fine print that you're unsure of, and we'll guide you through the entire process. I know some of you have been messaging me throughout the entire process. I have your details. I will make contact with you and assist you to the best of our ability. Thank you.
Thank you. Thank you very much, Daniel. And Kandel, any closing comments?
Yes, Dr. Dorgo. I'd just like to thank everyone who took time out to sit into our webinar, and I hope that the information was valuable to you. You can return to your workplaces and really evaluate the way in which work is being done. And with the oil and gas sector in Guyana, health and safety will be very critical for all of our businesses, especially high-risk businesses. So do not take safety for granted, because safety can cost us a lot. And we've seen the impact that in working in an unsafe environment, what it can have on our productivity, on our profits, on our staff. So let us have that safety culture developed. I must congratulate a number of the organizations who would have implemented the safety culture since the oil and gas sector, has come into Guyana. We can look at the shore base, for example, as a good example of the safety practices in place that were not there before. So we encourage our local businesses to get on board. If you require training, you can contact us, contact Daniel, and we can arrange a training session for you and your team. Or you can join us in one of our public classes that we may run very shortly. To Dr. Dorgo, thank you for facilitating us. It's always a pleasure working with you and your team to promote standards and quality in Guyana, because I know this also supports the objectives of your company, where you're also working with businesses to improve business performance and productivity. And I'm sure you will agree with me that safety is key if you want to be a productive business. So I'll just close by saying that having a occupational safety and health system that is effective will indeed increase productivity. Thank you.
Thank you very much, Kandel. And there's nothing much left for me to say. You have my support. I know that this is one of the key steps that we need in our country in order for us to be competitive. We talk a lot about local content. We talk a lot about local jobs and people getting involved in this particular industry and any industry. And this is one of the steps, So what I'm very happy about is that we're not just talking, we're actually doing, and all the organizations that are interested in actually doing as well. I'm sure that GCS will be able to support them from a registry side, and we at Action Invest here are also ready and willing to help from the business side. So thank you very much, Kandel and Danielle. If anyone else would like to share anything in the Zoom group, feel free to do so. I see a lot of people are thanking you, Kandel and Danielle, for all the useful information shared. And I look forward again to hosting you in the future when we further look at the other standards that are available. Thank you very much.
Thank you.
Thank you. Is there anyone on the call that would like anything else clarified? I've shared my contact details in the chat box. Feel free to reach out to